I'm often asked, why have I devoted my career to Lyme disease? I'm Dr. Daniel Cameron. I'm introducing this topic as part of my Common Sense Lyme disease series. And I can tell you that I wasn't planning on working with Lyme disease. I had been planning on geriatrics when I went to the University of Minnesota. And after 10 years, I set up my practice in Mount Kisco, and I realized that Lyme disease was such a complex illness. It's so difficult to take on Lyme disease and the complexities of Lyme disease. It introduced a lot of the chronic issues that I had seen in geriatrics, the misunderstood issues that showed up in various geriatric problems, including dementia. And when I took care of Lyme disease patients, I realized that it's something I could do what I can to help my patients and to help understanding of Lyme disease. There's a lot of research, advocacy, and education going on, but as an individual trained at the University of Minnesota, having a degree in epidemiology, I thought that I would do my part to try to help my patients get better, but also participate in the process. I got involved in 𝐒𝐈𝐍𝐿 as an International Lyme and Associated Diseases Society. I was author of two of their treatment guidelines, the evidence-based treatment guidelines, and also 𝐒𝐈𝐍𝐿's president. And since then, I've been writing science blogs. I've been participating in the research discussions that are out there. And I'm really aiming at trying to bridge the gap between doctors and researchers who have taken a rather conservative approach to Lyme, that haven't had haven't taken on a persistent chronic infection very readily. They've decided to call it a syndrome. But Lyme disease patients are struggling, and so I find that a centrist position involved in both treatment and research discussion allows me to be a player in Lyme disease and do what I can to discuss my perspective, hear their perspective, and move forward. I'm also encouraged by a number of researchers who are trying to understand Lyme disease, understand the co-infections that are out there. And so I am grateful for the opportunity to be able to do what I can to help with the process, both for the patients I see in my office in Mount Kisco, New York, as well as my work in advocacy and participation with my colleagues. So I'm hoping that over time that we can come together on a way to handle this complex infections born from a tick. And thank you for joining me for this Common Sense Lyme disease series. If you